Hi, I'm Dr. John Lenihan from Tacoma, Washington. I'd like to talk today about the device I'm holding in my hands. This is the Renessa, R-E-N-E-S-S-A device for treating urinary stress incontinence. I was involved, fortunately, in the pivotal trials that led to this device being approved by the FDA almost 5 years ago. This device uses small microelectrode needles that deliver low voltage radio frequency energy to the bladder neck, causing the bladder neck to be remodeled, causing the collagen to be broken down, thus strengthening and stiffening the bladder neck, helping with incontinence. This device, even though it's been approved for 5 years, has been slow to get out because of reimbursement issues. Most insurance companies considered this as a new device, experimental, and weren't paying for it until just recently. In our state, in Washington, we finally have Aetna and Medicare approval are starting to cover this, and we're starting to enable us to use this on our outpatients. The advantage of this device is it is truly an office-based outpatient procedure. Our patients come in with minimal sedation, get a small periurethral block, have the treatment, and walk out and can go back to work the same day. There has just been, at the AAGL this year, where I'm at here in Orlando, there's just been data presented showing significant improvement and significant benefit to quality of life. The 40 to 45% of women who weren't totally cured are very happy, so there has been a pleasure rate from the patients, being satisfied with the outcome of their procedure, enabling them to be more active and do more things without having to worry about incontinence. There's been less than 5% of the cases have had required other treatment or were unhappy with a long-term outcome. And again, for a simple, non-invasive office procedure that any gynecologist can do in the office, that's pretty good results, I think. We're going to show a little close-up of how this works, but again, I just wanted to update you that if this isn't available in your area, it will be soon, and check with your local insurance companies about reimbursement. It's an office-based procedure, requires only a local anesthetic, and is getting very, very good durable results over 5 years. Thank you very much, Dr. John Lenihan in Orlando at the AAGL. This is the Renessa device that's made by Novasys Medical in California. This is the device we now use to treat urinary stress incontinence in the office. It's a very simple device. It's connected by a cord to a smart generator that delivers the radio frequency energy to the 4 prongs that come out of the device. What we do is, after we numb up the urethra, we inject little saline or water into this tip of this balloon. We put the balloon in the urethra and we deploy the prongs, which come out in 4 quadrants. Each prong has a little thermistor on the end, so they can actually monitor very carefully the temperature we deliver. We activate the device with a foot pedal, and we treat for approximately 60 seconds and release, turn it 45 degrees, treat for 60 seconds, turn it 45 degrees, treat for another 60. As we're doing this, water is flowing into the bladder, which constantly expands the bladder neck, so our treatments actually move down the bladder neck as it expands. The whole process takes approximately 10 minutes. The patients are very comfortable. They leave the office in void, and it's been very, very successful in our practice treating urinary incontinence this way.